Stasis, a company showcase.
All right, hello everybody. To start off with, by a raise of hands, who here works in the healthcare space? Great. Now, who here has seen a doctor before? And those not raising their hand are probably not paying attention. Cool. Everyone interfaces with healthcare. And something that's always really driven me crazy is historically, healthcare access has always been defined by socioeconomics and geography. And in current times, technology is actually offering a way for us to change that. The challenge has often been that when you look at the Western world, where decades of innovation have been happening in health IT, and where all the big companies are based, all the R&D leads are, they're often out of touch with the rest of the world and what the rest of the world needs. So if you look at this part of the world, whether it's Central Europe and Middle East, Africa, Asia Pacific, the market has different problems, and thus they require different solutions. And that's been a big part of what I've been really spending my life trying to focus on. My company is called Stasis. Founded it almost a decade ago at this point. And the mission behind it was to really accelerate the practice of medicine to be more proactive. And what doesn't really make sense to me is today we usually are reacting to some issue, right? Someone has a heart attack or something goes wrong, and then you go and you try to treat care. Proactivity means you actually are informed, you know what's going on, and you can anticipate that and do something before a bad event happens. The challenge has often been to be able to deliver proactive care, you need data. You need data to go to the right person at the right time. And this is where I think a lot of healthcare has really struggled. So if you look at a lot of these kind of next layer applications that people in care are talking about, whether it's telemedicine, at this conference, AI is a big topic, or clinical decision support, digital records, health information exchanges. Well, all of these solutions are only as good as the data they have and the quality of that. And so what we've been focusing on is how to make that accessible for people around the world, whether you have a lot of infrastructure or barely any at all. So far as a company, we started off by launching in the Indian healthcare market, and we've cared for almost 100,000 patients so far across of India. And I actually, myself and my partner, just moved here to Dubai this week, so brand new. And the idea being to really come and innovate more in the Middle East and North Africa region, and using this to kind of set up a hub to impact the broader kind of 𝐒𝐮𝐬 and APAC markets. And something that I've, at least as an American coming here, I've really appreciated in the MENA region is the mindset and the whole ecosystem that's being developed here. It's very innovative and open to be thinking differently, looking at the West and taking learnings from the West, but not afraid to do it differently based on what the local market needs. And they're putting their money where their mouth is, which I think creates a really interesting time for all of the healthcare innovation that's happening here. You know, the other thing that I would like to say is that whether you work in healthcare or you do not work in healthcare, everyone is impacted by it. And I think it's really important for all of us to really come together, because it does take a village to really be able to impact care and bring it to its next level. And so, you know, whether you are in care or you're, say, in AI or blockchain or in gaming, a lot of these different principles can be applied to care to do something better. So I just want to leave you with this. It doesn't matter how rich or famous or healthy you may be. In the end of the day, every single one of us has to interface with healthcare, and so it's really important that we're thinking about how to bring these technology tools really to the masses. So thank you very much.